Hello mga ate, mga kuya. How are you today? Hope you guys having a good time. As you noticed, I'm trying to speak myself here in English language so that other folks can relate para maintindihan din ng ibang mga aliens. So in today's video, we are going to talk about healthcare in Canada, here in Canada. But before we get started, if you're new to this channel, please welcome. Consider subscribing to the channel and check out some of my video. If you are a certain subscriber, well, thank you so much for watching another one of my videos. So without further ado, let's get started to the topic, guys. Our title for today is healthcare completely free in Canada? Free ba talaga? Well, people sometimes say that Canadians have free healthcare. Libre daw. But Canadians pay for their healthcare through taxes. Kinakaltas niya sa sahod nila buwan-buwan. You didn't even realize it that you are paying for it through taxes, and it feels like it's free because you only carry the green card or health card, not a cost, when you go for a checkup, a doctor's checkup. In the US, guys, in the United States, patients are like to pay for healthcare through premiums or co-pays, they call it. So healthcare is never free. There's no such thing free in this world, especially in healthcare. Oh my gosh. How does Canada afford healthcare? Canada has, they call it, decentralized, universal, publicly funded health system called Canadian Medicare. Healthcare is funded and administered primarily by the country's 13 provinces and territories. It has its own insurance plan and it receives cash assistance from the government, from the federal government, on a per capita basis. In Canada, here in Canada, public health care is paid through tax money. Basic healthcare services like hospital visit and medical treatment are all free. All Canadian citizens and permanent residents may apply for a public health insurance or OHIP. Once you approve, you get an Ontario health card, the green color card. That's the health card, guys. This means that Canadians, including permanent residents, can visit a doctor for checkups or health concerns for free. The doctors will bill the government. So the doctors will bill the government for their services. They can see specialists and receive treatment and surgery for illnesses. Your health card proves you're covered by OHIP or Ontario Health Insurance Plan. That's why you always show it to them, to the doctor or specialist every time you see them for your appointment. OHIP includes coverage for hospital stays, visit to the doctor, appointments, with most specialists, podiatry or foot health services is free also. Eligible dental surgery in hospital is free. Eligible optometry or eye health services is free. Medical or surgical abortion is free. Travel for health services. If you live in the northern part of Ontario, I don't know why, some medical items like the use of wheelchair or electric wheelchairs, hospital beds, walkers, crutches, canes, traction equipments, pressure mattresses, insulin pumps, breast pumps, and many more. I remember one of my patients that, because I'm working as PSW, the moment I'm visiting her, she had always new wheelchair, the standard one. And I asked them, you guys bought this by your own pocket? Because the first wheelchair that she's using is not comparable to use. So she had one. She had a new one and looks new. The moment I come back the next day, he said, "You guys bought this?" And they said, "No, it's from the government." Oh, that's amazing. It's free, libre. So once your card nearly expired, guys, your health card nearly expired, you will get a notice from the Service Canada that you need to renew it, and there is no cost to renew your Ontario health card, and it's free. Once you have that, guys, you have that health card, enjoy living the life in Canada. It's free for healthcare, but it's not totally free actually. You're paying for that through taxes. Every month, the company deducted it for you. Okay, so, but there is there is treatment, that medical treatment that is not covered by OHIP. What are those, guys? Let's check it out. Now, there are services that are no longer covered by OHIP or Ontario Health Insurance Plan. Revisions to Ontario Health Insurance Plan means some Ontarians will have to pay out of pocket for some procedures that were once covered. Some of the changes includes, first is fewer x-rays for sinus-related problems. CT scan will be used if imaging is required on sinuses, as x-ray shown to be not as effective. So more effective pala yung CT scan. So this is not free. New referral system for patients with chronic hip and knee pain. Not free. Earwax cleaning will only be done when medical is necessary. Coverage for earwax cleaning is no longer available. Doctors will now charge you for the services unless the earwax is causing hearing loss. Next is reducing the use of dipstick pregnancy test. Blood pregnancy test will now be used in place for dipstick test, which will only be insured if the patient needs result to prevent imminent harm. Next is house calls physician. Ito yung mga matatanda na cannot afford to go out anymore kasi mga fragile na sila. House call physicians, premiums for house call will only be funded for patients who are frail, seniors housebound, and receiving palliative care. They are not free. The use of ambulatory cardiac monitoring device, loop recorders, and outdated technology used to evaluate cardiac electrical activity in our patients are no longer be funded. So these are not free. Referrals to a specialist, patients are no longer need to visit their primary care provider for a letter to see a specialist. They've been already seen for the same problem within 2-year period. So it's not free. Next is infertility diagnosis testing. OHIP will no longer cover post-coital testing for cervical mucus, a method now considered to be outdated. They're not free. Next is larynx exams. Laryngoscopy services will only be provided when medically necessary. Next is pre-operative assessment. History and physical assessment by family doctor are usually requested. Yes, usually requested before an operation by surgeon. Although they are not medically required, now patients will be assessed by the surgeon and anesthesiologist before the surgery to determine the right anesthetic care. So these are not free, guys. So those are the services that are no longer covered by the OHIP or Ontario Health Insurance Plan. Generally speaking, guys, some dental procedures here in Canada is not free. However, the free dental care under OHIP or Ontario Health insurance plan is only limited to oral surgery, which is performed only in the hospital in only limited situations such as correcting birth defects, surgery for diseases of the jaw, correcting damages to the jaws. OHIP coverage does not include regular dental care like checkups, fillings, x-rays, root canals, and tooth removal. These are not free. You're going to pay for it, guys. Some hospitals have dental clinic, however, OHIP or Ontario Health Insurance Plan dental coverage does not apply to regular dental care. That's why all the dentists here in Canada are all millionaires. Lots of money, guys. Mayayaman sila kasi dyan sila kumikita, which is dental care here. Some of them here in Canada, the dental care procedures, some of it are not included in OHIP. So you're going to pay for it. Sometimes when we go to Philippines, that's the time we go for cleaning because Philippines is more cheaper than here. Yes, guys, that's true. So I don't know why when we go home next year, or so that's the time I can go for cleaning. But actually, I'll do take care very well on my mouth care. So there's not to worry about. Okay, guys. So guys, that's all for today's video. Hope you all enjoy. Please give us a thumbs up and click the subscribe button below, and also the notification bell icon for the new video uploaded. Thank you for watching, guys, and see you on the next video. Bye. Thank you.